Hi guys, thanks for joining. Today I will be talking to you all about the flu vaccine. Every one of us by now hopefully has a basic understanding of the flu vaccine. So today I'm going to delve deeper into some of the specifics of the vaccine. But first the basics. The flu vaccine protects the recipient from the common forms of influenza viruses. Specifically, they target the two that harm humans the most, type A and type B. You can see that H3N2, also known as the swine flu, and H1N1 are different subtypes of the type A. And both of these subtypes are more severe to humans than the type B flu. The vaccine is distributed on a yearly basis because influenza virus mutates at such a rapid rate. And finally, there are many different kinds of flu vaccines. Vaccines differ in the method of route or administration and in valency. The flu vaccine protects the recipient against type A and type B influenza. The vaccine triggers an immune response against hemagglutinin, which is the most common glycoprotein found on the lipid envelope. This protein helps attach the virus to the surface of the cell and aids it as it enters the cytoplasm. There are actually 4 types of flu, but you might not have heard about type C or D because they rarely ever show up in the headlines. Type C is rare and causes very mild illness, and type D only affects pigs and cattle. The 2 kinds of flu to watch out for are types A and B, and of these 2, type A is more severe. Because it's so severe, a lot of attention and research is directed at type A. Type A influenza can be divided based on the combination of its 2 common surface proteins, hemagglutinin and neuraminidase. There are 18 different variations of hemagglutinin proteins and 11 different types of neuraminidase. You will commonly hear people abbreviate the names of the proteins and use their numeric identifier after that to signify what kind of type A virus they mean. For example, H1N1. Swine flu and H3N2 are the 2 types that circulate the most in humans. As I said earlier, a new flu vaccine is administered on a yearly basis. This isn't because your body loses its immunity, but because the virus changes very rapidly. There are 2 methods of change. Antigenic drift is the one you are probably aware of. It occurs when small mutations happen to the virus that affect the antigen proteins. This is a normal process, and usually if the mutations are minor, your immune system is able to still recognize a mutated virus despite being mutated. This is called cross-protection. However, over time, those mutations add up to the point where your immunity against the old flu won't recognize the new flu, and the person will lose his cross-protection. A less common, yet more impactful way the flu can change is by genetically reassorting with other kinds of influenza A viruses. This process is called antigenic shift and will occur in an animal reservoir where the 2 viruses can be present at the same time. The genetic changes that occur to the virus are much more dramatic than a single mutation and can oftentimes lead to a completely different subtype of virus. An example of this occurred in 2009 with the swine flu outbreak. The different kinds of vaccines contain either inactivated influenza, recombinant influenza, or live attenuated influenza. So there's a lot of diversity when it comes to the vaccine type. There can be many different reasons why a person might receive one kind over another. For example, only those 65 and older should receive the vaccine containing the MF59 adjuvant. Vaccines can be either trivalent or quadrivalent. Trivalent vaccines target H3N2, H1N1, and 1B antigen. The quadrivalent vaccines contain an additional B antigen. And finally, there are 3 main routes of injection. One route of injection includes a no-needle jet injection. This method involves shooting a high-pressure, narrow stream of fluid through the skin. There's also a nasal spray and a standard needle injection. The history of the flu vaccine spans back to the 1940s, with the development of the first inactivated flu vaccine. 2 decades prior, between 1918 and 1920, the Spanish flu was responsible for the deaths of anywhere from 20 million to 100 million people. The method used chicken eggs to replicate the virus, which, as you will see, is a method still used today. In 1945, the vaccine was approved for civilian use, and in 1947, it was determined that the virus had mutated to the point where the current vaccines were ineffective. It was at this point that the investigators realized the need for constant surveillance of flu viruses. A few years later, following a pandemic in 1957, the U.S. Surgeon General issued the recommendation to the public to get an annual shot. In 1999, oseltamivir and zanamivir are licensed to treat people suffering with the flu. In 2003, the nasal spray was developed, and in 2012, vaccines utilizing cell-cultured viruses became available. This obviously is not an exhaustive list of events, but it highlights some of the major events to occur in the history of the vaccine. Like I said earlier, there are a bunch of different methods of producing the flu vaccine. Each of the methods begin with the CDC or World Health Organization influenza surveillance system, providing vaccine manufacturers with candidate vaccine viruses or CVVs. The egg-based flu vaccines involve introducing the CVV to fertilized chicken eggs. For the inactivated virus, the fluid with the replicated virus is harvested, inactivated or killed, purified, tested, and packaged. For the live attenuated vaccines, the virus is attenuated in the lab, usually by repeated culturing. That fluid is then purified, tested, and packaged. For the cell-based flu vaccines, a mammalian cell culture is used instead of an egg. The process of purification and distribution is the same. Recombinant vaccines do not require CVV because the recombinant vaccines are created synthetically. DNA from the virus encoding the hemagglutinin is combined with a different virus called baculovirus to produce a recombinant virus. This virus is then administered to a cell line so that the antigen can be grown in bulk. The antigen is then extracted and purified. I thought this image was particularly helpful at depicting the process as it occurs. For the cell culture-based vaccine, the only difference between it and this row for the egg-based vaccine is that the virus is grown in a cell culture in this first step. There are some restrictions with the flu vaccine. There is a vaccine available to anyone 6 months of age or older. However, there are some age restrictions depending on the vaccine type. For example, only individuals between the ages of 2 and 49 should receive the nasal spray vaccine. For pregnant women, they should also not receive the nasal spray vaccine. Immunocompromised individuals and people with severe allergic reactions to a vaccine component should also consult an expert when determining which vaccine is right for them. The vaccine is generally administered between September and October, right before the flu season, which reaches its height between December and February. Many studies have been conducted to assess the effectiveness of the flu vaccine at preventing infection, hospitalization, and death. In the figure on the next slide, published by CDC, I show the vaccine has had a positive impact on those three things. On a final note, it's important to keep in mind the fact that this is a rapidly changing virus, so the protection you receive from your vaccine will likely not carry over into the subsequent season. There have been some complications with the flu vaccine, which I have listed here, but many of these are either rare, like Guillain-Barré syndrome, or minor. This figure contains the estimated number of averted illnesses, medical visits, hospitalizations, and deaths in the 2019 to 2020 flu season by age group. I've highlighted the totals at the bottom here. Even though these totals are only estimates, To think that the vaccine has saved 6,000 people's lives is a good note to end on. That's all I have for you guys. I look forward to answering your questions tomorrow. Bye.